Medic Life, Episode 16. What's vital? Stoked for stroke and mental health tips, plus the GT Medic. You can find it all in this episode. What's up, lifers? It's Wednesday night and time for your weekly dose of Medic Life, where we delve into everyday topics in EMS. Yes, this show is jam-packed, so stick around. Before we get started, I want to take a brief second and say thank you to our partners at EMS Today 2016 and Distant CME. You can find links to their pages and the updates from them on our site, mediclifetv.com. So in our first segment, it is dedicated to vital signs. So what's vital? I tell my students all the time there's a minimum of 4. Yes, 4, you got them. Vital signs. Pulse, respirations, manual blood pressure, and guys, that first one's got to be manual blood pressure. You are better than the machine. You're better than the monitor. And last but not least, blood glucose. You got to check everybody's sugar. There are 2 key components for sustaining life. One of them is oxygen. The other one is glucose. We've really got to quantify the effectiveness of these 2 key components. So we do this by measuring vital signs, and particularly those 4. Now, those are not the only 4. And I don't want you guys to get confused with that. We're all the time making jokes about, well, this is the 5th or the 6th or the 7th or the whatever vital sign. We're always coming up with new ones. But we want to quantify those 2 key components. National Registry now is wanting us to look at what's going on at the base cellular level. And understanding what is going on at the base cellular level takes a little bit of understanding about these 2 key components. At minimum, I say these 4. So pulse and respirations give us an idea about the cardiac function in conjunction with respiratory. Where are they hemodynamically? And that's the question we're always asking ourselves. Blood pressure is going to let you know about cardiac output, or how well they're perfusing. Are they hypotensive, like hypertensive? Are they meeting those demands? Your blood glucose, this is that thing that's going to tell us, did they have the fuel in the tank? So can they meet those energy demands? It's one of our rule-outs. When we talk about those folks who are altered, those patients with altered mental status, how are they progressing? What's going on with them across that progression from normal status to now they're altered, and what's the cause? We always like to ask the why question. Our index of suspicion often leads us to believe that our patient is having a stroke. So in this case, for the stroke, we must act fast. Now, yeah, I did a little play on words there. I was talking about stroke. So that play on words there, FAST is one of the acronyms we use for stroke. So face, arm, speech, time to call 911. Oh, a fun video for you guys.
On an ordinary day, there in the kitchen, Grandma started to sway. Grandma sounded strange when she spoke. Daddy had to ask, what if my grandma's having a stroke? I think I better act fast. I think I better act fast. Does her face look a little bit uneven? Does one arm
So that's kind of a fun little video. And you can find the link to this video in the full description of this particular episode. So I placed it there for you guys. And I encourage you. This is not copyright protected. I encourage you guys to utilize this in your stroke training. Pass it around. Get this information out to people. So let's talk about some of those risk factors for stroke. Well, hypertension is one of those. Those folks with a BP that's greater than 180 over 115 are at the increased risk factor. And those who have uncontrolled, untreated diabetes, or they don't actually follow the recommendations of their physician. When we couple in things like obesity, sedentary lifestyle, this does put them at risk for diabetes. Diabetes is also on this list of risk factors. So it's smoking and even family history. Now, this is not all of them, but this is a good portion of them. So what do we need to know as the pre-hospital professional? We have to ask that question, when was this patient last seen normal to themselves? Any recent trauma, seizures, headache? What is normal? What's baseline for them? Now, yes, we are going to ask those OPQRST questions, onset, provocation, quality, radiation, severity, and time. We're going to ask those sample questions. We're going to know about allergies, medications, things like that. We're going to take in the big picture. So we have a couple of evaluative tools. So I placed up for you guys one more time the old FAST. This specifically, minus the call 911, is the Cincinnati Pre-Hospital Stroke Scale. And it's one of two that are the most common out there in the pre-hospital setting, the other one being the Los Angeles Pre-Hospital Stroke Scale. Cincinnati is actually part of the Los Angeles Pre-Hospital Stroke Scale. So we'll start with the Cincinnati. And the thing we want to look at is facial droop. So we ask them to smile. I always like to say, shut your teeth. Just smile real big. We have them hold out their arms, the whole close your eyes, grip my fingers kind of thing. All right, when I let go, let's see what happens. Hold your arms up, right? And we hope that they don't rotate or their arm doesn't drip down. So that's what we're looking for. And of course, we have them say, you can't teach an old dog new tricks. This goes back to that first little lead-in segment, which was blood glucose. We know that people with altered mental status can present like a stroke patient, especially if their sugar is off. So we do that rule out, check their sugar. Now, the American Heart Association has published that you should treat the sugar, but I would tell you guys out there in EMS land, follow your protocol about what that magic number is. If there's still an index of suspicion that is a stroke, how do you want to treat them? But the magic number for the American Heart Association, at least in their publication, the 2010 guidelines, and they haven't really changed anything in the 2015 that I have seen. Still perusing through that stuff like a lot of you guys are, and it is a lot to read. But the magic number is 50 milligrams per deciliter. I want you guys to look at your protocols. Talk to your med control physicians about this kind of stuff, so you can figure out maybe the best course of action for your patients. And the reason I also tell you blood glucose is if you look at that Los Angeles Pre-Hospital Stroke Scale, the bottom portion is that Cincinnati Stroke Scale. They just got it broken down into the left and the right-hand side. The other portions are, and the big ones are, did they have a seizure at onset, or was there any trauma? What was their glucose level in between 60 and 400? And are they bedbound or wheelchair bound normally? And then we talk about age, like over 45 and things like that. We start getting more and more in depth. And in all honesty, guys, I'm actually surprised that I can sit here and say all that stuff to you off the memory, because it's not one that I commonly use, and I know a lot of you guys don't either off the top of your head. It's just easy to remember 3 things. Now, you guys should have the stroke checklist somewhere in your protocol book, maybe in an app, somewhere. Whether you're doing fibrinolytics pre-hospitally, and guys, there are some awesome advances out there in pre-hospital stroke care. I believe the service is in the Houston area or the Dallas area, anyway, and I'm thinking Houston for some reason, that they actually do portable CTs in the field. They've had some wonderful results with their stroke care in the pre-hospital setting. Canada, I think I saw recently, within the last 6 months, it's been in the news. They've been talking about doing those kind of things. So we've made a lot of advances. Whether you're doing the care pre-hospital or not, when you're providing those fibrinolytics or not, I would say to you guys, make sure that you go ahead and try to complete that check sheet if you can. All the yeses have to be yes. All the nos have to be no. Again, blood pressure is a big one. Recent trauma, bleeds, any active bleeding, and blood pressure. Blood pressure is 185 over 115 or greater. So I have provided for you guys the latest recommendations and the links about stroke in the description of this video. Down here, while you're looking, look way over here, and you probably see a little subscribe button. Click on it. Subscribe. So if you have any questions or comments, feel free to leave them on YouTube, on my website. You can send me an email. Just give me a shout out there, and I will do the best that I can to get you that information, answer any questions that I can for you. The latest guidelines, which, by the way, you guys may not know, and I was surprised to know that they had did some interim studies. So there were the 2010 guidelines, and the 2015 are actually based off of some studies and information. So if you seem confused about maybe what the links are about and why it says 2013, well, that's what it's about. This next section, as I promised you guys, some more mental health tips to kind of get you through the holiday season. And Dr. Sciloi, who is a psychiatrist there in Pennsylvania, you guys maybe remember him from our PTSD in EMS episodes. If you haven't seen those, check him out. Go back, and some excellent words of wisdom from him about PTSD and EMS, and it's really kind of becoming a big issue. He couldn't really be with us tonight, so he sent me in a set of, well, it's 10 tips. I actually am posting those up. They'll go live tomorrow for you to read the whole thing. But I'm just going to kind of give you the overview of these 10 tips for minimizing holiday stress, anxiety, and depression. So the first one, he says, give yourself permission to feel. It's okay. It's normal to feel a range of emotions, and it's okay to express them. You don't have to be happy all the time. Don't isolate. Sometimes we feel we're not happy, and we feel like we do have to be happy, so we don't want to be around other people. If we're separated from our family during the holidays, that does make it a little more difficult as well. His words are, be around other people. Spend time. If somebody invites you to, hey, come to a Christmas party or come over to my house and hang out, eat dinner with us or whatever, if you have nowhere to go, nothing to do, it's okay to be around people. Manage your expectations is number 3. He says exercise a healthy realism towards the holidays. No, not everything is going to go perfect. If you think it's going to go perfect, you're in for a disappointment, and you may resent the whole holidays to begin with. Set aside those resentments This is the time of year where we're getting to the end of the year. We're looking to the next year. We want to get away from holding on to stuff. Just let it go. Express compassion. Practice forgiveness. Accept your friends and family as they are. I think probably over the years you guys have probably become desensitized or accustomed to your family. Your level of acceptance probably waxes and wanes. You're not going to really reverse anybody's past behavior. You can't control others. Don't try to. Just kind of go with the flow. Just let go of the past and live and enjoy the now, the happiness of the holiday season. Even if you're not happy, you don't have to be happy again. Remember, it's not a requirement. Be financially responsible. Yeah, I'm going to pause for effect there. He said be financially responsible. We almost feel obligated during the holiday seasons to, or at least during Christmas time, to buy gifts for everybody. But, you know, in today's socioeconomic climate, it's just not realistic. I know a lot of you guys are already working 2, 3 jobs just to make ends meet, or maybe you're working that one job, but you're working those extra shifts, those extra long hours, doing everything you can to just basically make ends meet. So when it comes to shopping for gifts, holiday groceries, create a budget. How does this fit in with your normal budget? And then stick to it. You know, the old joke is you can't buy happiness, or money can't buy happiness. And people's comment is, well, have you ever seen anybody who's rich that's unhappy? And, well, yes, there are rich people who are unhappy. So don't spend yourself into regret and misery. Don't try to buy happiness. Don't try to buy your own happiness through giving to others. You'll regret it in the end. Proper planning is our next one. So proper planning is good prevention. Don't wait until the last minute to buy gifts or do your holiday shopping. Guys, and I'm saying you men out there, maybe I should point that finger at me. Yes, we like to wait to the last minute. We hate holiday shopping. There's some really cool advances in modern technology. Yeah, that was kind of funny, I know, right? The Black Friday, that day after Thanksgiving, wasn't probably as big as it used to be because a lot of you guys waited for Cyber Monday week. Just remember, if you've decided that you're going to use modern tech like Amazon or ordering directly from some XYZ company, make sure that you properly plan for shipping and delivery. It's no fun to order something only to find out that it's not going to be there, or you waited to the last minute, and with this heavy season of shipping and mail and things like that, it's going to be the middle of January before it gets there. So keep that in mind. Next on the list is just say no. Avoid overcommitting, as it will likely leave you feeling stressed out, overwhelmed, and resentful. You cannot do it all. Now, some of these I've kind of been paraphrasing, but I read that one specifically word for word for you guys. Just say no. Avoid overcommitting. Pick those things that are specific that you want to do. If you're married, you have kids, talk to your spouse and go, okay, last year this is what we did. We went and saw these people. We saw those people. Let's pick who we're going to see on which days, and let's maximize our enjoyment and our time at each location or each event that we go to, instead of trying to just get little snippets here and there. You're just going to be stressed out and running around. And I can honestly tell you guys, Medic Life Studios is here in Augusta, Georgia. That's where I currently live. My wife and I grew up in North Alabama. All our family lives. So when we go back home, we've always tried to see everybody. Over the years, we found out that it's not realistic. So what we've tried to do is we've said, okay, we're going to pick one location, so maybe my mother's house or one of my sister's house, and we're going to go, okay, this is where we're going to go, and we're going to stay for X amount of days. And then we're going to go to her parents' house, and then we're going to come home. We're not going to try to drive to each and every person's house, see all the friends. It's just not realistic, and it's stressful. So I encourage you guys, make a plan. Next is avoid overindulging. And I talked to you guys a little bit before Thanksgiving about food. So yeah, Christmas is not really any better than Thanksgiving. As a matter of fact, it's worse. We're actually going to the mountains for Christmas. We're going to the Roan Highlands there, Roan Mountain, Tennessee area. Staying in a cabin. And my wife asked me, she's, what are we planning on doing for food? Well, we're going to do that for 3 or 4 days. What do you want to do for Christmas? And we start naming off all this stuff, and I kind of laughed, and I was like, all these things that I've been telling people not to do, we've just made this list. Pies and cakes and goodies and stuff, and we are in the process of remaking our list. So I encourage you guys, if you're healthy, stick to your healthy routine. If you're not making good choices, again, I will say to you, this is not the time. I'm shaking my head no. This is not the time for you to start a diet. Find moderation. Overeating and excessive consumption of alcohol, it can lead to feelings of guilt and shame. And yes, alcohol's a present. We like to drink and stuff and party, but remember that. Try to get some exercise in. No, it's not the time to start an exercise routine, but again, if you're going to be out shopping, going and seeing folks, park the furthest away, walk. Get some exercise in. Find some things that you can do with your family that help promote not just sitting around and eating food and talking. Find fun things to do to get up and move around. Number 9 on the list, take time out. Decompress, breathe, meditate. Whoa, right? Yes, meditate. Or as some of you guys like to say, woosah. Pray, take a nap, take a walk, read a book, get a massage. You have to decompress. If we go back and we talk about some of these other aspects, we talked about the stress aspect of just the holiday season, trying to go here or there, making everybody happy, this, that, and the other. Take time for yourself. Take time for yourself. Whether it's 5 minutes, 10 minutes, half an hour, whatever you have to do to just take that time, take a deep breath, and kind of let it all out. Now, the last thing on the list is ask for help. If you find yourself experiencing persistent depression or anxiety, particularly if you are feeling hopeless and helpless, seek the help of a mental health professional. I'm going to add for you guys one more time the links for Code Green campaign. So there's some help and hotlines there for you guys. They were in the PTSD video, but I think I'll add them to this one too. Don't feel ashamed to talk to somebody. Enjoy yourselves. Now we're going to close out this week's episode. As I promised, a few words from the GT Medic. This is his video this week. Some of you guys saw last week. He finished with Medic Up, and I didn't really understand what that was. So this was intended to be a segment where he just sort of kind of gave us some rants, but it seems like it's not turning out to be that way, and I'm pleasantly surprised. I really like it. So let's learn about Medic Up, guys.
Hey everybody, it's Jeremy the GT Medic. Last week I did a rant for John, and at the end of it I mentioned the Medic Up slogan, and he wasn't really clear on what that meant. And I didn't explain it to him ahead of time. But Medic Up is a slogan that I developed recently in order to sort of promote not only EMS and EMS education, but also just to sort of promote like professional development in EMS, as kind of a reminder, just like a little slogan as a reminder to always be the best provider you can be. And this includes improving your education, and doing regular professional development training, as well as just kind of a way to live your life as a professional EMS provider. That's really what it comes down to. So you'll see the hashtag on Twitter and other social networking sites, as well as I'm going to be putting out some videos on YouTube here independently as well. So you will be hearing this slogan more often. We're going to be making up some t-shirts and other swag, if you will. So there'll be a lot of Medic Up swag coming out here shortly. But yeah, so that's kind of an explanation of it. Again, just to promote excellence in EMS, just as a reminder to always Medic Up.
Alrighty, well, awesome. Hey, thanks there, GT Medic, Jeremy, for sending in that little blurb for us this week. Not really a rant, kind of educational and fun. He and I haven't talked about this, but he puts out some stuff. I'll put up a way for you to find it on my site and links to that. So yeah, I'll put that information out there for you guys on my website as it comes out available, so that you can have access to it. That's all the time we have this week. Don't forget to subscribe to our YouTube channel. Like and share us on Facebook and Twitter. Go to our website, mediclifetv.com. Get your latest information and updates from, yes, those wonderful folks at EMS Today 2016. If you want to be a well-informed lifer, don't forget to get on our email list, and you can sign up on the contact page.